morning, afternoon actually.
Welcome to our next episode of Gin and Tonic. So we wanted to do a little bit of lead, like a, what do you call it, lead? Follow on to last week's episode. Because when we turned off the cameras, I sat and spoke to Claudine about more of my symptoms. And I'm actually postpartum. So, kind of almost over the postpartum period. She's 16 months. But we were talking about how breastfeeding impacts the estrogen levels and progesterone levels. And I think it'll be nice to discuss a few of the contraception options that we had, because we delved into that a little bit. And the new fad and phase of testosterone being part of peri-menopausal and menopausal treatment. So I'm going to hand it over to you.
Yeah, so I think nothing quite prepares you for pregnancy, nothing quite prepares you for delivering a baby, no matter which way you do it, and unfortunately there's only two ways. And then nothing really prepares you for postpartum.
And I think so many people speak about postpartum depression, but nobody speaks about even the simplicity of sleep deprivation, which I've been having a lot of. And we all spoke about how that kind of makes you feel unraveled. And combined with the estrogen levels and progesterone levels not being, or your whole hormonal panel not being, how would you say it, optimized?
Yeah, so I think your body's trying to do lots of different things, especially if you're breastfeeding. It's trying to produce enough milk to sustain another life. And in doing that, it definitely depletes you as a human. In terms of those hormones that are required to produce all of that, it then has knock-on effects, which we discussed is very similar to perimenopause. And amidst all of this, one is meant to, as a woman, still, buy the food, cook the food, be a good wife, and
keep all the balls in the air juggling.
Whilst you're sleep deprived. Sleep deprivation is used as a war tactic, as a
torture method.
I
mean, look at internship, how many studies they've done of doctors post-call and how driving, how that sleep deprivation affects driving. I think it's almost the same as being intoxicated.
Yeah, it's the same as being drunk.
So it's quite debilitating. And I love the European countries where it's like a year that you take off maternity leave, and here it's like 4 months and we're supposed to be back in the saddle and everything is supposed to be okay. And sometimes when you don't have that tribe around you, you don't have those hands helping, it falls all onto you. And then it's a lot to take out. It's a mammoth task. And as women, we don't talk about this. We don't talk about our struggles. I think we're just supposed to smile, act good, everything is nice, take an Instagram picture, the kids are healthy, and we're supposed to move on.
Yeah. So I think 100 years ago, 150 years ago, we had ceremonies, and we had communities where when you were pregnant, you weren't expected to work. You were taken care of in a way. And then once the baby was born, that community was there. You certainly weren't expected to cook, So,
and they helped nurture the baby. They helped nurture you. You were in this loving environment where,
and it was sacred. It was considered sacred. We've lost that, and we've replaced it with this mad hamster wheel, multitasking, and never mind that, we've set the standards out the ballpark. The lunch boxes must be with 7 different colours of absolutely everything that people can't even afford. The meals that you cook must be gourmet, even.
No, but it's true.
You must rustle it up as if you became a chef, which you didn't.
Yeah, you must meet this level of living and the standard of living that's actually, for a lot of us, I don't know if it's unreasonable, it's not doable, even with the time frames that we have. Like, I don't know. Okay, if there's moms out there who can give us tips on how to do it, well, please. This is not to put you down in any way, but it's to say that not all of us can. I think for me, I am struggling, and I think it takes a lot for me to admit that.
Yeah.
But I've come to a point where I feel safe with Claudine, and I can admit that, and I am so happy that I can admit that, because you giving me those encouragements, those daily encouragements, and not putting me down for asking you a stupid question where I'm like, I can't remember the dose of this, because I know the dose, but you're tired, and it just helps to have somebody around to lean on. And that for me has been such a amazing thank you. So that has brought me a long way, I think. So
yeah, I mean, I just think our modern way of doing life is, I don't think it's sustainable going forward. You know, I would want different for my girls.
I think it's important to build your tribe, and I don't think that it has to be within your family. I think it has to just be a good tribe, whether it's friends, colleagues, whether it's people that you employ, just people around you to help. Because I think help has become difficult. It's difficult to ask for help. It's difficult to seek help. I think it's important to build a tribe.
And to do it without guilt.
That's true.
Yeah.
Okay, so let's talk about testosterone.
Yes. So, like Solly said, there is this current trend of women taking testosterone either by injection or by topical. And I think the important thing, like anything, is to do things safely. So, yes, you can access these things, and compounding pharmacies compound things, but is that safe?
So according to the British Menopause Guidelines, which I read recently, so even in South Africa, there is no oral approved testosterone for females. And what they're trying to treat is that hypoactive sexual desire disorder. But actually we're supposed to correct, like how you said in the last podcast, we're supposed to correct the estrogen levels before we then look at testosterone. Because then we can only say that you need to add on testosterone.
Correct, yeah.
And then I think the only SAPRA approved, so SAPRA would be the Pharmaceutical Council, is a gel, is a testosterone gel. But even overuse of that, and we know the side effects, it can lead to
hoarse voice, clots,
decreased breast tissue, and clitoral changes.
Okay.
As well. And unfortunately, they're not reversible, and more hair growth, excessive hair growth. So
the long and the short is rather use it safely under the guidance of somebody who has studied further along the lines of that.
100%. So endocrinologist would be a good...
Endocrine, I think some gynaes have studied further.
And I think even if it's specialist initiated, it can always be continued on GP level.
Correct.
And we can continue. We can even initiate if we do the bloods and workup, but as long as the patient is aware of the